Focus. Ideate. Innovate. Enable.
Hello and welcome to this week's episode of Making It Big Season 7. I'm your host AB Ravi. There is this old saying we learnt in our school days. Where there is will, there is a way. Simply put, it means if you are determined enough, you can find a way to achieve what you want, even if it is very difficult. Well, the hero of this week's episode applied this saying and succeeded in having his way. Vishnukant Bhutada, the man who came out of nowhere and operates out of a small town, has made a big mark in the pharma space. Shilpa Medicare, the company he founded some 3 decades ago, is among the world's leading suppliers of oncology and non-oncology active pharmaceutical ingredient and formulations. Little wonder it has grown from 10 lakh rupees turnover in 1988 to 800 crore rupees company today. Take a look at Shilpa Medicare story. It gives you the prescription of how to create your own path in any business, even if that space is crowded by big boys.
Since his early college days, he has been determined to make a difference in whatever he pursued. It is this die-hard determination that saw Vishnukant Bhutada, the affable founder of Shilpa Medicare, create a strong niche for his company in the global pharma space in a span of 3 decades. Witness this: about 80% of his company's active pharmaceutical ingredients and formulations are sold in the most regulated markets of the USA and Europe. Clearly, Vishnukant's being different approach has yielded rich dividends. Today, Shilpa Medicare has emerged as a fully integrated pharmaceutical company producing oncology and non-oncology APIs and formulations. Besides, it also offers CRAMS or contract research and manufacturing services through its API plants located at Raichur in Karnataka and formulation plant at Jadacherai in Andhra Pradesh. While its Raichur plants produce a whole range of oncology and non-oncology APIs and intermediates, its Jadacherai formulation plant produces 100 million tablets, 13 million capsules, 4 million liquid injectables, 2 million lyophilized injectables, and 2 million pre-filled syringes. All these products are predominantly exported to the USA, Canada, Australia, Japan, and Europe. Besides, these plants also serve the markets of South America, Africa, and Asia. Clearly, the world is their oyster. But the path to success was not an easy one. To hark back in time, Vishnukant, the youngest of the 7 children, was born into a Bijapur-based business family who were into tires and textiles trading. From his school days, young Vishnu always wanted to be different. So after his schooling, unlike most youngsters of the Maheshwari Marwari community he belonged to, he did not opt for a commerce degree. Instead, he enrolled at the Raichur-Based VL College of Pharmacy affiliated to Gulbarga University to acquire a B Pharma degree. In 1986, with a degree under his belt, Vishnu did the unthinkable. Instead of joining the family's trading business, he decided to get into pharmaceutical manufacturing. It was a bold move, as none in the family had any experience in this field. Thus, within a year, in 1987, Shilpa Medicare came into being in Raichur, Karnataka. Again, an unusual move, given the fact that almost all of the nation's pharma clusters were around Mumbai, Ahmedabad and Hyderabad. The company started as a contract manufacturer, producing trimethoprim, IBBP for companies like SKF, Bombay Drug House, US Vitamins and Sandoz India. Encouraged by the good response, it added more products like sodium methoxide, norfloxacin, and ingredients for ranitidine over the years. Besides contract manufacturing, the company also managed to export directly. The biggest turning point came in the 90s when Vishnukant decided to bet on oncology APIs when the majority of the players were betting on cardio, diabetes and other diseases.
In 1999 or 2000, our vision was to go in oncology. So it was the main turning point for us and we have succeeded. It has taken little time, but we have succeeded.
After that, there was no looking back. The business blossomed. It was Vishnukant's constant research on his competitors' portfolio, a close watch on emerging trends in the European markets, and active engagement with the industry experts that have enabled him to find gaps in the market and launch products from time to time. Here, instead of reinventing the wheel, he adopted the acquisition and joint venture strategy. Thus, as a part of this strategy, he acquired new therapeutics and Navya Biologicals. Besides, he also entered into strategic joint ventures with Italian and Austrian firms. All these initiatives and strategies have given Shilpa Medicare a leg up. Besides, what has also given the company an edge is its strong R&D focus. This has not only enabled it to earn high margins, but also create a niche for itself in a very competitive domain of oncology products. As many as 11 oncology APIs and 4 non-oncology APIs have been developed in its R&D, and these have been successfully transferred for commercial production. The company has 18 more oncology drugs in the pipeline.
9 years back, R&D was very small. There was no regulatory affairs department. There was no IPM department, which is intellectual property management department. There was very small analytical development department. In 9 years, we are very good now in R&D center, analytical development. IPM is new generated. We have almost more than 100 patents published. So we are able to do everything. So these are the major change which lead to develop the new process and cost-effective process, and quality is good. So that was the total change in 9 years.
All in all, the company's sharp R&D focus and an impressive clientele list have boosted its financials. Between 2012 and 2016, Shilpa's sales turnover recorded a CAGR of 17.72%. Sales jumped from 318 crore rupees to 719 crore rupees. Likewise, the net profit too rose in tandem from 41 crore rupees to 99 crore rupees, registering a CAGR of 19.15%. This impressive performance has enabled the company to consistently pay higher dividends over the last 10 years. Shareholders have not only been rewarded by dividends, bonuses and share splits, but also by share price appreciation. To give you an interesting perspective, your investment of 1 lakh rupees in the company's IPO in 1995 could have been worth 2.15 crore rupees now in 2016. Impressed by Shilpa Medicare's focus and the pace of growth, private equity players like Bearings and Tano Capital have picked up stakes in the company.
There are always risks when you invest in a company. So yes, this company was looking to get into formulations, so it was going to be a big investment. We invested into the company for that. It was also going to build a large custom synthesis plant in a JV with an Italian company. So there was execution risk, but when we looked at the company, we saw that they had pretty good execution capability. They had the respect of their customers, their clients and the peers in industry. There was respect for its R&D capabilities. More than that, Vishnuji, who is the promoter, also invested into the company through warrants along with us at the same valuation. So this showed that he was very confident about the future of the company.
Clearly, the company has come a long way. In the last 3 decades, it has grown from being a small 14 employees company to a pharma powerhouse with over 2,200 employees. The future seems bright with Vishnukant determined to ride the next wave, betting on biologics, new drug delivery systems and nanotechnology. All these will not only provide succor to people suffering from debilitating diseases, but also catapult the company into a higher growth trajectory. On that optimistic note, it's time for a short break. When we come back, CNBC TV 18's AB Ravi talks to Vishnukant Bhutada about his journey and vision. Also joining us on the show is Sandeep Uppal of HSBC. Stay tuned.
Welcome back. He is clearly a bottom-line driven and intensely focused pharma man. His goal is to make life comfortable for those suffering from diseases. I caught up with 54-year-old Vishnukant Bhutada, MD of Shilpa Medicare, at his factory in Raichur in Karnataka to find out how he managed to carve out a distinct niche in the pharma space against established companies despite being a rank outsider. This is what he has to say. Take a look. Vishnu, Sandeep, welcome to the show. Vishnu, when I began by asking you, your family was into trading business, basically into tires and textiles. So what prompted you to get into the pharma business instead of getting into textiles or tires where you had a core competency?
Since childhood, I was fascinated doing something different than what other people are doing it. So I thought instead of going to the traditional business into the where we can do the typically Marwadi Maheshwari family which go backward and forward, I thought that to do something different than what other people are doing it. That is the reason why I started looking onto the pharma.
So how did you make it different? By getting in doing B Farm?
First of all, in our family, normally the people goes into the commerce line. I selected the science. In the science, then I selected I thought that let's do the pharma, where the health sector probably going to be the bigger sector in the India and the world. I diversified into the pharmacy.
Okay, Vishnu, you started a contract manufacturer for some of the big companies in the pharma space. So what gave you the confidence to move away from being the third party manufacturer to come on your own? First you started with API, then you moved into formulations.
See, without much experience I started this pharma company because there was no, in our family history, nobody was there into the industry, and that to pharma nobody was there. I started the company. But starting the company, then we realized that starting is not enough. We have to run it. And that too also we are far away from the other cities like the so-called civilized city like Mumbai and the Ahmedabad, Hyderabad. And to getting the talent power here, the talent, the people and other all was difficult. So initially we thought that let's start with the contract manufacturing. But that was not enough to run the company and take to the different level to the company. We thought that let's make it 50% for the contract manufacturing where the immediate revenue will come. I can pay the salaries and all, and the balance 50% invest for the future. This is where in 2000, around 95, 96, I started diversified into from the contract manufacturing to the other sector.
Okay. So for a company of your size, way back in the 90s, you betted big on oncology when the world over everybody was betting on diabetes or heart care diseases. So what made you take this bet?
I used to read a lot of articles during that time because I was having plenty of time. So when we have realized and attending the seminar, the Western world was because of the food habits and all, everybody was pointing out that the cancer will be the next, disease will come up in a big way. I thought that this is an area where probably it will not go up too much, but it will be a niche area for that time and in the future. That is the reason why I thought let's invest into the oncology.
So how much does oncology contribute to your top line, bottom line?
Now currently the 40% of the top line is oncology.
Top line is 40%?
40%.
So if I were to ask you, what is the challenge of your business? Is it R&D, is it regulatory approval, is it talent acquisition, it is competition? What is the challenge of your business?
All probably.
Okay. So how do you surmount it?
See, you have to focus on each segment because the regulatory is again important too, because without regulatory approvals you cannot export to the other all over the world. No customer will approve your plant. Getting the talented, because to get this, to keep these approvals you need the talented manpower. To retain the talented manpower in Raichur and the other places was a difficult task. Invest again into the R&D. Select this proper sector in this that will keep your company growing to the next level. Immediate revenue is also important. So blend of all probably has made us the to.
So if I were to ask you, if you look at your R&D product that has come out, a number of patents you have filed and awaiting regulatory, how much would all this add up to?
Now probably we have 34 products already developed. 44 products are in the R&D to come in next 3 years to 4 years down the line in oncology, and 14 products are there in a non-oncology in a API segment. Around 8 to 10 the ANDA we are going to file in every year. Around 32 ANDAs are under the pipeline now. So this is the way we are trying to grow up in this.
Okay, let me get Sandeep in. Sandeep, what is about Shilpa Medicare that singularly appeals to you or strikes to you?
I would say engineering excellence, if I can call it that, because if you look at the company, it has proven that success is not overnight. So it spent 3 decades in getting its base right, which was around API, it was about CRAMS, and only in the last few years it moved into formulation. So I think what really stands out for the company is that it's taken its time, but very sure-footed way to set up the platform for success later on.
It's not a top-line driven company, it's a bottom-line driven company. That's what the promoter's philosophy is. Again, if you look at their interest outgoes, is very nominal. They're a debt-free company. So when you look at all these figures, and 80% exports, and if you were to do a SWOT analysis on Shilpa Medicare, what would it be?
I guess strength very clearly is the manufacturing base that they developed over the years. It's about their strength in oncology. It's their strength in Europe. If I look at where the weakness lies, is the fact that they still haven't made a mark in US, which is the next geography to conquer, and also to go down the formulation path. And if you talk about opportunities, their weakness is their opportunity, because as Vishnu was articulating earlier, they can look to develop massively in the US, they can look to grow massively in formulation. And as far as threat is concerned, I think that kind of applies to the sector, that it's a regulatory threat. So you just have to be on your toes all the time.
Vishnu, what is the philosophy of business? When you set up this whole pharma business?
Philosophy was more driven for the innovation was the one, and medicine is not only the enough. See, you have to give the medicine with the innovation, with affordability, and ease of the administration of the medicine is also equally important.
Okay, Vishnu, in the last 3 decades, you have grown from 14 employees company to 2200 employee company, from 10 lakhs turnover to 800 plus crore turnover. So 5 years from now, how will Shilpa Medicare look in terms of product ranges, in terms of new product launches, in terms of turnover, in terms of market share?
Shilpa was never the on a top line driven company, but the sector in which we are investing into the like the oncology, the film technology, the biosimilars which just started, and the nano just started, and each sector has a billions of dollars market share. And if we feel that probably we should be able to take the moderately 5% of the shares during 5 years or 10 years down the line. And our past history shows that we have grown from 10 to 30% every year.
What's unique about Shilpa Medicare?
Shilpa Medicare is not the pure generic company. Shilpa Medicare has always invested into the innovations and the difficult generic molecules, which is not easy to crack even to the big companies. This is the reason why we are investing into the sector where though the gestation period is higher, 5 years or 7 years down the line, but we invest in each sector. That is why Shilpa makes, like the first time the film technology was launched by India by Shilpa. Why not all the big companies were there. Nano, probably we are the 1 or 2 companies who are thinking in it. Biosimilars, 4 to 5 companies are doing it, and we are there in a mid-sized like company ours. Oncology, we were the few among during in 2000, we are doing it. So I can say that the Shilpa is investing into the different than what other people are doing it.
Okay, going by your own business, what are the mantras you applied in your business to succeed?
Success is again, invest into the innovations, and invest into the talented manpower. Retain the team which you have it and nourish them over the years. See that your team needs you. That time you should be available to them. In their difficult times, You should be there always. They should feel that you are the family members in their difficult times. So these are the things which will make your company to retain the talented manpower and grow into that sector.
Suppose some youngsters came to you for advice to start a business, or your sons came to you. What would the advice you would give your son about the do's and don'ts of the business? What they should do, what they should not do if they want to start business today?
If really they wanted to start the business, then the quality is the most important. I think never compromise on the quality. Never compromise on your fundamental values. You should have a passion for the work which you are doing it. You should, above all, you should learn, love the country where you are staying it.
Okay.
These are the things I think which will make you and easily accessible. Attitude should be the very good. You should have a very good attitude towards the employee or in the society. So these are the things I think which will make you to success into the any sector.
Do you believe in luck?
Probably 20%, but 80% I believe into myself, my family, my friends, my team. That will give you again what you wanted.
Okay, Vishnu, very well put. Thanks a lot for being on the show. Sandeep, thanks a lot for being on the show.
Thank you.
Thank you. Well, that was Vishnukant eloquently articulating his vision of where he wants to take Shilpa Medicare. Well, these are the mantras he implemented to build Shilpa Medicare. Invest in innovation. Talent acquisition and retention is a must to succeed. Maintain quality standards. Be ethical in all your dealings. And finally, be passionate and believe in yourself. Well, by assiduously following those mantras, Vishnukant is now laughing his way to the bank. You too can do likewise. Before I go, here's an interesting observation made by Pierre Omidyar, founder of eBay, and I quote him: if you are passionate about something and you work hard, then I think you'll be successful, unquote. On that thinking note, it is time to say goodbye. See you next week with another interesting episode. Till then, keep watching CNBC TV 18.
Focus, ideate, innovate, enable.